Hello, I am John, and today we're focusing on blood pressure, the silent killer that affects nearly half of all adults over 60 in America. The good news is that high blood pressure is one of the most controllable health conditions out there, if you know what to do. Therefore, today's 20 questions will give you real solutions and practical steps to take control of your numbers. Let's get into question number 1.
All right, starting off, what blood pressure reading is now considered high for most adults? A. 140 over 90 or higher. B. 130 over 80 or higher. C. 150 over 95 or higher. The answer is B. 130 over 80 or higher. The guidelines changed in 2017 because research showed damage to arteries begins earlier than previously thought. If your numbers are creeping above this, it's time to take action, not panic, but act. Question 2. Which mineral is most important to limit for lowering blood pressure? A. Calcium. B. Potassium. C. Sodium. C is correct, sodium. Most Americans consume over 3,400 milligrams of sodium daily when the recommended limit for high blood pressure is under 1,500 milligrams. The simple fix is cooking more at home, reading labels, and choosing fresh foods over processed ones. Now, question 3. What is the single most effective lifestyle change for reducing blood pressure? A. Taking supplements. B. Losing excess weight. C. Drinking more water. The answer is B. Losing excess weight. Let me elaborate on that. For every 2 pounds you lose, your blood pressure can drop by about 1 point. You don't need to reach your ideal weight to see benefits. Even modest weight loss of 10 to 15 pounds can make a significant difference. Let me expand on this because it's genuinely encouraging. A landmark study published in the Journal of the American Medical Association followed overweight adults with high blood pressure for 2 years. Those who lost just 10 pounds reduced their systolic blood pressure by an average of 7 points, which is comparable to what some medications achieve. The participants didn't follow extreme diets. They simply reduced portions, cut back on processed foods, and walked more. Another study from Johns Hopkins found that combining modest weight loss with the DASH diet lowered blood pressure by an average of 16 points. That's often enough to move someone from needing medication to managing naturally. Small, sustainable changes add up to big results. Now, question 4 coming up. Which of these foods can actively help lower blood pressure? A. Canned soup. B. Bananas. C. Deli meat. B is correct, bananas. They're rich in potassium, which helps balance out sodium and relaxes blood vessel walls. Other potassium-rich foods include sweet potatoes, spinach, avocados, and oranges. Adding these to your daily diet is a delicious way to support healthy blood pressure. Well, let's keep moving. Question 5. How long should you sit quietly before taking your blood pressure at home? A. No waiting needed. B. About 5 minutes. C. About 30 minutes. The answer is B. About 5 minutes. Rushing around and then immediately taking a reading gives falsely high numbers. Sit with your feet flat on the floor, arms supported at heart level, and relax for 5 minutes first. This simple step ensures you're getting accurate readings. Question 6. What type of exercise is most effective for lowering blood pressure long-term? A. Intense weightlifting only. B. Regular aerobic exercise like walking or swimming. C. Stretching once a week. B is correct, regular aerobic exercise like walking or swimming.
Quick check-in, are you keeping score? Drop your total in the comments when we finish. I always enjoy seeing how everyone does.
Aim for at least 150 minutes per week. That's just 30 minutes 5 days a week. Consistent moderate exercise can lower your systolic blood pressure by 5 to 8 points. Start where you are and build up gradually. Question 7. Which beverages can raise blood pressure and should be limited? A. Herbal tea. B. Water with lemon. C. Alcohol and excessive caffeine. C is correct. Alcohol and excessive caffeine. More than 1 drink per day for women or 2 for men can raise blood pressure. And while moderate coffee is usually fine, drinking several cups daily can keep your numbers elevated. Switching some coffee for herbal tea or water makes a real difference. Moving on to question 8. What is the DASH diet and why does it matter? A. A high-protein meat-based diet. B. A diet rich in fruits, vegetables, and low-fat dairy while limiting sodium. C. A fasting-based eating plan. B is correct. A diet rich in fruits, vegetables, and low-fat dairy while limiting sodium. DASH stands for Dietary Approaches to Stop Hypertension, and it's specifically designed to lower blood pressure. Studies show it can reduce systolic pressure by 8 to 14 points within weeks. The DASH diet is one of the most researched eating plans for blood pressure, and the results are remarkable. It emphasizes 4 to 5 servings of vegetables daily, 4 to 5 servings of fruit, whole grains, lean proteins, and nuts and seeds while limiting saturated fats and sodium. A study from the National Heart, Lung, and Blood Institute found that participants following DASH saw blood pressure reductions within just 2 weeks. For some people, these results were comparable to starting medication. The diet doesn't require special foods or complicated recipes. It's about shifting your plate to include more plants and fewer processed items. Combined with the low-sodium version called DASH Sodium, results are even more impressive. Question 9. How does stress directly affect your blood pressure? A. It has no effect. B. It causes temporary spikes that can become chronic. C. It always lowers blood pressure. The answer is B. It causes temporary spikes that can become chronic. When you're stressed, your body releases hormones that constrict blood vessels and speed up your heart. Over time, constant stress keeps your blood pressure elevated. Finding stress relief through deep breathing, meditation, or hobbies isn't just relaxing, it's protective. Question 10, halfway there. Which of these is a hidden source of sodium most people overlook? A. Fresh fruit. B. Bread and bakery items. C. Plain rice. B is correct. Bread and bakery items. A single slice of bread can contain 150 milligrams of sodium, and most people eat multiple servings daily. Other hidden sources include condiments, salad dressings, and breakfast cereals. Reading labels carefully reveals surprising amounts of sodium in everyday foods. Question 11. How does sleep affect blood pressure? A. Sleep has no connection to blood pressure. B. Poor sleep can raise blood pressure over time. C. Sleeping too much lowers blood pressure dangerously. B is correct. Poor sleep can raise blood pressure over time. During normal sleep, your blood pressure dips by 10 to 20%. If you're not sleeping well or have sleep apnea, you miss this critical reset. Aiming for 7 to 8 hours of quality sleep actively supports healthy blood pressure. Question 12. What is white coat hypertension? A. A type of heart disease. B. High readings at the doctor but normal at home. C. Low blood pressure when standing. B is correct. High readings at the doctor but normal at home. Anxiety about medical appointments can temporarily spike your numbers. This is why home monitoring is so valuable. If you consistently see normal readings at home but high readings at appointments, share this information with your doctor. Understanding white coat hypertension can save you from unnecessary medication. Research published in the Annals of Internal Medicine found that up to 30% of people diagnosed with high blood pressure actually have white coat hypertension. The problem is that if you're treated based only on office readings, you might take medication you don't need. The solution is simple. Invest in a validated home blood pressure monitor and track your readings at different times of day for a week or two. Bring this log to your appointments. Your doctor can then see your true average and make better treatment decisions. Home monitoring puts you in control. Question 13. Which everyday activity can significantly raise blood pressure temporarily? A. Reading a book. B. Having a full bladder. C. Sitting in comfortable silence. The answer is B. Having a full bladder. A full bladder can add 10 to 15 points to your systolic reading. Always empty your bladder before checking your blood pressure at home. It seems minor but makes a real difference in accuracy. Question 14 now. How does potassium help manage blood pressure? A. It increases sodium retention. B. It helps your kidneys flush out excess sodium. C. It thickens the blood. B is correct. It helps your kidneys flush out excess sodium. Potassium and sodium work together as a balancing act. Most people get too much sodium and not enough potassium. Increasing potassium through foods like leafy greens, beans, and citrus fruits helps restore this balance naturally. Question 15. What should you do if your blood pressure is suddenly very high? A. Exercise immediately to bring it down. B. Stay calm, wait 5 minutes, and recheck before contacting your doctor. C. Ignore it since one reading doesn't matter. B is the answer. Stay calm, wait 5 minutes, and recheck before contacting your doctor. A single high reading isn't an emergency unless you're having symptoms like chest pain, vision changes, or severe headache. Panicking raises it further. Stay calm, sit quietly, and recheck. If it remains very high or you have symptoms, seek medical attention. Let's continue. Question 16. How much can reducing sodium intake lower systolic blood pressure? A. About 1 point. B. About 5 to 6 points. C. About 20 points. B is correct, about 5 to 6 points. That might sound small, but it's significant. Combined with other lifestyle changes like weight loss, exercise, and the DASH diet, these reductions add up quickly. Many people lower their blood pressure by 15 to 20 points without medication through combined efforts. Question 17. Which relaxation technique has proven benefits for blood pressure? A. Watching action movies. B. Deep breathing exercises. C. Scrolling social media. B is correct. Deep breathing exercises. Slow, deep breathing activates your parasympathetic nervous system, which lowers heart rate and relaxes blood vessels. Just 5 to 10 minutes of deep breathing daily has been shown to reduce blood pressure. Try inhaling for 4 seconds, holding for 4 seconds, and exhaling for 6 seconds. This technique is backed by solid research and costs nothing. A study from the American Heart Association found that seniors who practiced slow breathing exercises for 15 minutes daily lowered their systolic blood pressure by an average of 9 points over 8 weeks. Another technique called the relaxation response, developed at Harvard Medical School, showed similar results. The key is consistency. Just like exercise, the benefits come from regular practice. Many people find it helpful to build breathing exercises into their daily routine, perhaps first thing in the morning or before bed. Apps can guide you through the process until it becomes second nature. Question 18. How does quitting smoking affect blood pressure? A. It has no effect on blood pressure. B. Blood pressure begins dropping within 20 minutes of your last cigarette. C. It takes 5 years to see any benefit. B is correct. Blood pressure begins dropping within 20 minutes of your last cigarette. Smoking constricts blood vessels and damages artery walls. Within hours of quitting, your circulation improves. Within weeks, your risk of heart attack starts decreasing. It's never too late to quit, and your blood pressure will thank you. Almost done. Question 19. How often should someone with high blood pressure check their numbers at home? A. Once a year is enough. B. Once or twice daily, especially when starting treatment. C. Only when feeling unwell. The answer is B. Once or twice daily, especially when starting treatment or making changes. Home monitoring helps you and your doctor see patterns, catch problems early, and know if treatment is working. Take readings at the same times each day for the most useful information. Last question. What is the most important thing to remember about managing blood pressure? A. It's completely out of your control. B. Small, consistent changes add up to major results over time. C. Medication is the only solution that works. B is the correct answer. Small, consistent changes add up to major results over time. Blood pressure management isn't about perfection. It's about progress. Every healthy meal, every walk, every good night of sleep, every moment of stress relief contributes to better numbers. You have more control than you think, and it's never too late to start.
That's all 20 questions on blood pressure. Did you learn something useful today? Hit subscribe and give this video a thumbs up.